Good afternoon. Welcome to the Bureau of Disabilities Provider and Case Manager webinar. I'm Holly Wimsatt. It is good to be with you today. We appreciate you sharing some of your autumn afternoon with us. We have a number of items to cover today, but before we get started, just want to review how to utilize live captions. So if we can move the slide, thank you. Perfect. To turn on live captions and subtitles, select Caption Subtitles On in your video controls. To change the caption language, select Settings, Caption Subtitles, and choose the language you want. Today, we are going to have an agenda much like every other month. We'll have an update for all providers, that's inclusive of case managers, an update for health and wellness and traumatic brain injury waiver providers, updates for community integration, rehabilitation, and family supports waiver providers. We'll cover some trending questions and then do our usual call at the end of the webinar for future webinar topics that you would like to see us cover in a future webinar. All right, so updates for all our providers and case manager partners. So as in July of this year, the Bureau of Disability Services issued public notice on the intent to submit amendments for all 4 of our home and community-based service waivers. That's the family support, community integration and rehabilitation, health and wellness, and traumatic brain injury waivers. Those amendments went out for public comment, and we received a good amount of public comment and reviewed all of the public comment and took it all under consideration and submitted those amendments to CMS for approval. We are moving forward in preparation of implementation of the amendments, and guidance is forthcoming in anticipation of their approval on or before December 31st, 2025, which is the effective date of those amendments. We will send out an announcement once we receive CMS's approval, and then copies of those approved waivers will be available on our website, much like the current version of the waivers are on our website now. So we've had a few moves of our district office this year due to leases ending. Our BEADS District 4 office, which is in Terre Haute, moved to a new location. That new location is 2901 Wabash Avenue. We're in Suite 400. And again, we're still in Terre Haute. The phone numbers are the same. We don't at this time anticipate any additional district office moves for this year because we've covered all the ones where leases were ending. So if you want a complete list of all of our office locations, that is available on our BEADS webpage. We have a little reminder here. We have recently identified that there is inconsistent documentation when there is a paid family caregiver. So we are reminding all case managers for all 4 BEADS administered waivers, the FSCIH, health and wellness, and TBI waivers, that when there is a paid family caregiver, that needs to be documented in the person-centered support plan or service plan or PCISP. If you're not sure, if you're a case manager and you're not sure how to do that, there are resources in the resource page of the BEADS portal on how to do that. So again, this is important for data purposes. We want to know and need to know how many paid family caregivers are actually providing services. This helps us inform next steps and also helps us have additional data for our move into our waiver reset. So case managers, please make sure that you are documenting this appropriately and as required. If a case manager isn't sure, that's a simple question to ask a provider or a family member. If you're not sure who the staff is, just ask and document it appropriately. Okay, some updates for providers and case managers on the health and wellness and traumatic brain injury waivers. So we have some reminders on service planning, some friendly reminders. Service plans or PCISPs submitted to BEADS. I just see a typo where we said Bureau of Disabilities, but we didn't put the services in there. Are reviewed in the order in which they're received. So please remember that if there are specific situations that should be escalated, you can email BEADS help for a quicker review. Now, if it's important that you escalate only those that really need to be escalated. That would be people that are at risk of losing supports, or if there's a safety concern for an individual. The portal has the extension functionality so that those service plans or PCISPs are extended as needed. We have, in full transparency, we've had some issues with those extensions and the accuracy of them, but we should not see providers stopping services when there's an extension plan. If there is a loss of supports or potential loss of supports, please send us an email at BEADS Help, and we'll look to prioritize that particular PCISP review. So interruptions and terminations, just want to talk through that with case managers and also an awareness for providers. It is very important to accurately utilize the interruption, extended interruption, and waiver termination functions as necessary. These need to be entered promptly and correctly to ensure that the individuals that we are supporting have continuous and appropriate support as they navigate through different situations or life experiences. The portal has several grids to help track those statuses for case managers. There's the waiver interruptions grid, interruptions expiring soon, interruption and termination requests for more information, waiver, interruption, and termination denials, withdrawals, and closures, waiver restarts, and then returning to previous waivers. So as case managers on the health and wellness and TBI waiver, you know now since July, right, that you've been in the BEADS portal, that the portal functions on grids, and whether it's a case manager or a BEADS staff, state staff, we go to those grids to check statuses and to see what our workload potentially is, those things that we need to review or take some action on. So this is different than the previous system. So we hope that case managers are getting used to utilizing those grids, but wanted to include just a little bit of information, reminders on interruptions and terminations, and highlight some of the relevant grids related to those. Requests for authorizations or RFAs. If an RFA was approved in CAMS and it has been resubmitted in the portal to BEADS, please send us an email at BEADS Help with the HIPAA name and the date it was approved in CAMS, if you know that, if you have access to that. If your agency has many in this status, you can send us just one email. This will help us ensure that we're getting those approved while we're still working through also the newly submitted RFAs. To monitor in-process RFAs, you can navigate to the PCISP tab and then scroll down to the RFA request grid This will show all of your, as a case manager, your RFA requests and the status they're in. This is also where those migrated from CAMS should be visible. Right. Want to talk a little bit about assessments. So there are certain services, as we hope everyone knows, that require assessments in order for the individual to continue receiving waiver supports. The help desk, the BEADS help desk, has been receiving a lot of tickets related to assessments. So we wanted to remind case managers to utilize the audit grid, which is pictured on this slide, to see if any assessments are missing. You can reference this table in addition to making sure if a help desk ticket is needed, it's submitted for the correct reason. So you can see on the grid here the PCISP, the level of care, whether it's ICF, IID, or nursing facility level of care, monitoring checklist, or the PCMT. And in the second row of the chart, the LOS, the level of care or level of service assessment. So that's important information, and that's what we're referencing when we're talking about certain required assessments. In addition to the level of care, there are, in some situations, the level of service assessment for specific services. Okay, want to provide an update on LCAR, or the Level of Care Assessment Representative. You may recall this is a statewide vendor as of July 1st of this year. The vendor is Maximus, and they are completing nursing facility level of care assessments and determinations. The level of care is nursing facility level of care, which is necessary or part of the eligibility for the health and wellness and the pathways for aging waivers. The vendor, Maximus, is continuing to work through assessments and determinations for the health and wellness and pathways waiver waiting list invites. So when someone's invited off the waiting list for either the health and wellness or the pathways for aging waiver, if they need a nursing facility level of care assessment, which means if the assessment that put them on the wait list is no longer current, Maximus will complete a new assessment. If the individual is a Pathways member, is over 60 and has Medicaid, a Pathways member, their MCE would actually do the assessment. Maximus is also doing the health and wellness and pathways for aging reassessment. So for those individuals, we'll talk strictly about health and wellness right now. For those individuals on the health and wellness waiver who have an annual level of care reassessment due, Maximus will do that reassessment. Now, this is where case managers and providers can be very, very helpful. Maximus is new to this and not exactly a familiar name to individuals and families. So please, if you are supporting someone on a health and wellness waiver, please encourage them to respond when Maximus reaches out to schedule their reassessment. You don't need to contact Maximus and say, this person needs their annual level of care assessment. Again, we're speaking strictly about nursing facility level of care. But you can support the individual and family by letting them know or reminding them how important it is for them to respond when Maximus reaches out to do that reassessment. The annual level of care reassessment is not new. That has always been a requirement, and it does need to be completed to ensure that the individual remains eligible for that waiver. So as case managers and providers, please support individuals and families in understanding the need to respond to Maximus to get those assessments completed. And then Maximus, oh, sorry, back one slide. Maximus is also, of course, taking new referrals for individuals who are seeking HCBS, health and wellness waiver, or the Pathways for Aging waiver. So again, if you are an independent case management company, or you are an area agency on aging, you do not need to submit or call Maximus more than once about a new referral. One time is enough, and then they will schedule an assessor, or an assessor will reach out to schedule with the individual that actual assessment. All right, next slide. Thank you. There is a training for area agencies on aging. This is a quarterly training completed or hosted by the LCAR vendor Maximus. That is taking place Thursday, November 3rd from 10 to 11:30. The agenda includes non-waiver to waiver, clarifying daily feeds from Maximus to the Area Agency on Aging, and then the TBI waiver waitlist processes. So if you're with an Area Agency on Aging, please make sure that you have this on your calendar and that you you register to attend this training. During the session, again, these are the things that will be covered, but there's usually always also time for questions. So it's a good thing if you can attend. And again, it's something that's done quarterly. So, and it's hard to believe that next week is November. I just have to say that out loud. All right, next slide, please. So just an update on the traumatic brain injury waiver. So to date, BEADS has determined 76 individuals who are active on the TBI waiver have met ICFID level of care. As a reminder, the TBI waiver is a little unique in that individuals may access that waiver if they meet nursing facility level of care or ICFID level of care, and they have, of course, a traumatic brain injury. So, but there are a number of individuals, 76, that are active on the TBI waiver right now, today, that are accessing that waiver with ICFID level of care. When their next reassessment is due, 90 days prior to the expiration of the ICFID level of care, BEADS will coordinate with the case manager, the TBI waiver case manager, on next steps. The BEADS portal will display the ICFID level of care and the date that it was done. So if you are a case manager and you're working with individuals on the TBI waiver, you should be able to look in the BEADS portal and see when that ICFID level of care is due. Okay. I want to talk about some guidance on IHCC, or Integrated Healthcare Coordination. So there was an IHCP bulletin for guidance issued for providers that provide integrated healthcare coordination. That IHCP bulletin is BT 2025-148. That came out last week, actually exactly a week ago on October 21st. The guidance in the bulletin is provided to remind IHCC providers of IHCC requirements, allowable activities, and documentation standards. So IHCC is a waiver service that's available under the Indiana Pathways for Aging, Health and Wellness, and Traumatic Brain Injury waivers. In order for an individual on one of those waivers to receive IHCC, the member's team, and the case manager, or in the case of Pathways for Aging, a service coordinator must assess the need for the service, as with any service on waivers, and include IHCC in the member's Person-Centered Service Plan, or PCISP. The waiver service can only be provided by an approved, an FSSA approved waiver certified provider. And those provider types for IHCC include home health agency, adult day facility, and FSSA or OMPP, Office of Medicaid Policy and Planning, approved physician practice, or an assisted living facility. Staff providing IHCC under one of the provider types must be a current licensed RN, LPN, or an Indiana licensed social worker, an LSW, with a master's degree in social work and at least 2 years of experience providing healthcare coordination. In this communication or bulletin, we noted that assisted living facilities and adult day facilities are required to provide, as an approved waiver certified provider, assistance with the following: assistance to the individual receiving services, those services, the following: activities of daily living, assistance in instrumental activities of daily living, so ADLs and IADLs, medication oversight and monitoring, medication administration, completion of healthcare assessments by an Indiana licensed nurse, monitoring the health status of the individuals, other required functions specific to waiver services or the provider's license, and then non-emergency, non-medical transportation. So what this means is IHCC services can't be used to perform the tasks I just mentioned. The IHCC services should be in addition to those services and that assistance, and based on the member's person-centered plan. The IHCC units should be based on the member's overall medical needs and should not be authorized for more or less than what the member and the member's team deems necessary to support the member's healthcare coordination needs. So again, as with any service, the level of service should depend on the need of the individual. And the waivers service of IHCC cannot be used to perform those components that we talked about that are part of those other waiver services like assisted living and adult day service. We have included here again the bulletin. It's IHCP Bulletin BT 2025148. If you want specifics or you want to download a copy of that and share that with other members of your organization or other parties. All right, we're going to move now to provider and case manager updates for the community integration and rehabilitation and family supports waivers. We will start where we cover every month, the provider attestation. And so I want to note, again, this is for providers on the CIH and the family support waiver. This does not currently apply to providers on the health and wellness or traumatic brain injury waivers. But if you are a provider of any service on the CIH or FS waivers, your provider system administrator must log into the BEADS portal and confirm the provider profile information at a minimum of every 90 days. All CIH and FS waiver providers are responsible for ensuring their provider profile remains accurate, and the provider attestation is a very simple, effective way to do so. It does not take long to do, I promise. The provider profile information should always be updated anytime there is a change in the provider profile. And you can do it at any time. You could go in every week and update if you choose. But the minimum is every 90 days. So we built in some flexibility here so that a provider can go in at any time and update their information in recognition of provider staff changes and other matters. But it is required at a minimum of every 90 days. If you're a provider and you need assistance with completing that attestation, you can look in the BEADS portal user guide for providers located in the resource section of the BEADS portal under the user guides tab. So the HCSP training and registry contacts. So this applies to the CIH and FS waivers only at this time. HCSP is Home and Community Support Professional. And we have here listed some contacts that you can reach out to. The support hours are Monday through Friday from 8 to 5. If you have training questions, you can reach out via email to hcsptraining@sierrahealth.com. You can utilize a live agent chat by clicking on the chat icon at the bottom right corner of the training platform for immediate assistance. And we have that site listed here. For training portal knowledge base, there's also a link here. For HCSP specific help, search HCSP in the knowledge base. Now for managers, please refer to your original group code and onboarding instructions email for guidance on getting learners onboarded and setting up your organization in the system. If you still need help, you can contact support@yeslms.com. And then for training portal technical issues, you can email support@yeslms.com. So we at FSSA actually envision all HCSPs who serve any population under an HCBS waiver will eventually have access to consistent core competency training. But right now, this is impacting the CIH and FS waiver only. The other thing I want to note about the HCSP training is a reminder, and we can go to the next slide, please, is a reminder that all HCSPs supporting individuals on the CIH and FS must complete that training by January 1st of 2026. We continue to receive quite a few questions regarding HCSP, and we want to remind you that there is an FAQ regarding the Home and Community Support Professional Training Program and Registry that has been added to the BEADS website under the BEADS resources. There's also a link to the HCSP training platform and the HCSP training registry. So we have this link here, but again, I want to remind all providers that all HCSPs need to have completed this training by January 1st of 2026. All right. So BEADS has a leadership training series. And I want to talk a little bit about that. Upon provisional approval of a BEADS new provider application for the CIH and FS waivers, leadership staff within the prospective provider organization are required to attend an introductory session of the BEADS leadership training series. The training supports new providers by providing information resources to build their business acumen as a BEADS HCBS provider. This is a day-long training, and it is offered in Indianapolis on a quarterly basis. And again, it must be completed prior to receiving final approval as a provider for the CIH and FS waivers. Any prospective provider has 1 calendar year from the date of provisional approval to complete the training. I should note, completing the training is not a guarantee of final approval. However, final approval will not be issued without completion of the training. Right now, this training is only open to new provider applicants in provisional approval status. We have been exploring further expanding this training opportunity because we've had a number of requests from active waiver providers that they would like to participate or have something similar. So we are exploring that, but right now, our focus in this introductory session of the BEADS Leadership Training Series is really on those prospective new HCBS providers. So for 2026, the training dates are, and I again, just can't believe we're talking about 2026 already. Monday, January 26th of 2026, Monday, April 20th of 2026, Monday, July 20th, 2026, and then Monday, October 19th of 2026. All the training sessions go from 9 a.m. to 4 p.m. Eastern Time, and all will be held in the Indiana Government Center South. This is the South Conference Center, Harrison Hall, room 22. Advanced registration is required, and again, right now, it is limited to those provider applicants in provisional approval status. Speaking of training, the Train the Trainer Core A and Core B medication training. So the final Train the Trainer Core A and Core B medication training of 2025 will be held virtually on Friday, December 5th, 2025, from 10 a.m. to 4 p.m. Again, registration is required for this. So please, if you are in need of this training, make sure you register. The attendee should bring a copy of the Introduction Core A and Core B Summary, Evidence Tables, 2020 Core A training materials, and 2020 Core B training materials to the session. Registrants must submit proper ID confirming employment with a BEADS approved provider of disability services and confirmation of being an active licensed nurse. Now that could be an RN or LPN, and that is a licensed nurse in the state of Indiana prior to attending the training session. This information can be submitted to our provider services, Celia Bartel at celia.bartel, that's celia.bartel at fssa.in.gov. Now, if you are a BEADS approved provider and registering for a nurse, please make sure that the nurse understands that they will need the Living in the Community Medication Administration Manual, a current LPN or RN license, and identification showing that they are an employee of a BEADS approved provider. Those items that I just mentioned must be submitted prior to the date of the training session in order for that individual to attend the session. Okay. The ICF ID and TRI implementation. So as I believe we have talked about, BEADS is implementing new tools to assess ICF ID level of care. This will apply for the community integration habilitation waiver, the family supports waiver, for some, the traumatic brain injury waiver, and also for individuals with intellectual and developmental disabilities seeking supervised group living or group home. These tools will replace the level of care screening instrument, or LOCSI, that we use today. And this will take effect technically December 31st of this year. We'll be implementing that as well. Now, those tools include the Enter-Right Early Years, which is for children age birth to 3, the Enter-Right Child and Youth Mental Health and Developmental Disability, or CHIME-DD is what it's called, for ages 4 through 17, and then the Enter-Right Intellectual Disability, or Enter-Right ID, for ages 18 plus. So again, we are pending CMS approval, moving away from the level of care screening instrument and moving to these Enter-Right suite of tools, which are designed to assess needs of individuals of all ages. The Enter-Right Early Years, the Enter-Right CHIME-DD addresses or assesses youth from a developmental standpoint, which our LOCC does not. So we're excited to implement these new tools. They're designed to be reliable. They're utilized in other states and in other countries. And we believe this will result in much more accurate assessment of need and also provide very valuable information to individuals, families, case managers, and teams as they look at connecting individuals and families with needed supports, whether that's community supports or HCBS or waiver supports. But certainly these tools are very, very comprehensive and can be utilized to really identify needs and address those by connecting individuals and families. The requirements for ICF-ID level of care have not changed. I want to stress that. It's just the tools assessing that ICF-ID level of care is what is changing. We have trainings this month, November and December. It's not November yet, very close, but not quite, where we will be training our district staff in BEADS who today complete level of care assessments utilizing the level of care screening instrument, and also training case managers on these new tools. Again, we're excited to roll these out and believe that it will be have a positive impact on identifying needs and supporting individuals and connecting individuals to the informal and formal services and supports they may need. All right. Behavior support services guidance. So we are, the amendments that are currently at CMS under review include changes or a reconfiguration to our current behavior support services offered through the CIH and FS waivers. On October 21st, we offered resources to both approved providers of behavior support services and case managers. Again, this is for the CIH and FS waivers. This does not currently apply to the 2BI waiver. The information we provided is designed to assist in the planning and implementation of the new reconfigured behavior support service that will be effective at the end of this calendar year. Those resources are also available in the BEADS Portal Resource tab. Those resources include a behavior support service transition guidance, a behavior support service planning guidance, it's a visual, and then a behavior support services elements visual example that identifies or kind of gives a visual of how different components of behavior support services may be used in a plan year. If you're an agency that provides behavior support services or a case manager and you did not receive those resources that we sent out, you can get them again via the BEADS portal. I just checked again, they're still there. So you would be able to access them there. And we have additional guidance that will also be forthcoming in addition to those 3 resources that are that were sent out last week. All right. Want to let you know, as providers and case managers, that our provider services team welcomed a new member, Heather Petty, recently. She is the provider re-verification and accreditation specialist. This primarily impacts providers for the CIH and FS. And Heather will facilitate provider re-verification process, monitor required accreditations, and then support the enhancement of provider training and continuing education. So you may reach her at bds.reporting@fssa.in.gov. But we welcome Heather, and we wanted you to hear her name because you may hear from her if you have a re-verification timeline approaching, or if she has questions about your accreditation. So welcome, Heather. We're glad to have her. Want to spend a few minutes talking about some sustainability measures and our efforts to build sustainable support for the future. Sustainability in our home and community-based services waivers is key. We want to make sure that our home and community-based service waivers are here in existence in some form or fashion for a long time to come. And in order to do that, we have to ensure that they're sustainable. So we have undertaken some efforts to ensure the sustainability of the 4 BEADS operated waivers. Some of the ways we're doing this is working with our partners to ensure compliance with service definitions. That is an absolutely necessary thing, given our service definitions are part of our waiver document that our federal partners at CMS approve. Refocusing all services on inclusion and supporting individuals in building connections in their community. Ensuring that the type and level of services a person is authorized to receive are based on current, relevant assessed needs of the individual. So those discussions with individuals about their needs, or those discussions when we're working on PCISPs, for example, should always start with what is the need, identification of the need, and then discussion about informal supports, community supports, formal services, but the needs are where those conversations should start. We're also looking, as part of our sustainability efforts, to increase accountability, increase consistency in case management across all our home and community-based service waivers, and ensuring that case managers are focusing on monitoring service delivery and utilization, monitoring an individual's health and safety, assessing service outcomes, and holding individual support teams or ISTs and providers accountable. We have to hold each other accountable to ensure that individuals are receiving supports and services that align with service definitions and that are based on their assessed needs. As providers and case managers, if you support individuals on the families or on the community integration habilitation waiver, we have asked case managers to review budgets with teams to ensure that those services on a PCISP are reflective and directly related to the needs of the individual. So you, as a provider, on the CIH waiver, for example, you may be contacted by a case manager to have that team convene and have that discussion. Our goal is to ensure that individuals are included in their communities, that they have access to all those services and supports that anyone not receiving home and community-based services has access to. That sounds familiar because that's a requirement of the HCBS final settings rule. And then that the formal services they're receiving, again, are directly related to assessed need, current relevant assessed need of the individual. So again, you'll likely get some contacts from case managers to make sure that we are really addressing needs of the individuals and really leveraging all those resources that may be available to the individual. All right, I'm going to move now to some of our trending questions. These are questions that we have received from those of you who have attended these webinars through BEADS Help, through a variety of different sources. So the first question is, can a BC take an individual to their own private residence to provide services? In other words, can an individual receive behavior services in the behavior clinician's home? And the answer is that that would not be appropriate. The service definition says behavior support specialists will observe the individual in their own milieu, their own environment, and develop a specific plan to address identified issues. The goals of waiver services are to provide the individual with meaningful and necessary services and supports, to respect the individual's personal beliefs and customs, and to ensure that services are cost effective. Specifically, waivers for individuals with an intellectual or developmental disability assist an individual to become integrated into the community where they live and work, develop social relationships with the person's home and work communities, develop skills to make decisions about how and where the individual wants to live, and be as independent as possible. So knowing that those are the goals or the components or the reasons for waiver services, an individual, a BC taking an individual to a home to provide a service would not be appropriate. That's the BC's environment, not the individual receiving the services environment. If the individual or the BC is working with the individual on building community connections, may be appropriate to be out in the community, supporting the individual in building those connections in the community, but not at the BC's home. Question 2: If bus passes or alternative methods of transportation are used, invoices and attendance logs must support days for which round trips are billed to the waiver. For bus pass purchases or Uber purchases, we are able to obtain an invoice or receipt. However, if someone uses one of these methods, there is not an attendance log. What are the suggestions in meeting this requirement? It's a good question. For bus purchases and Uber purchases, if an invoice isn't possible to obtain, a credit card statement that would document the bus and or Uber purchases would be sufficient. Regarding attendance logs, if there is no attendance log, a separate document maintained by the provider that indicates the name and RID of the Medicaid number of the individual receiving transportation service that was provided transportation through a bus pass or Uber, along with the date of transportation service, should be sufficient documentation. If you have additional questions, feel free to email BEADS Help. Question 3: If a BMGO provider serves a 60-day notice, can they, at the end of the 60 days, terminate if a provider is not determined? Does the team determine if the service is of ongoing nature or can the BMGO provider say this is not a vital service? So our response to that is in 460 IAC 6-9-1 that says this rule applies to all supported living services and support. So BMGO would be considered a support service being provided to the individual on an ongoing nature and therefore would be required to follow 460 IAC 6-9. I believe that should be -1. So yes, there is still that requirement that that applies to all of those supported living services and support. All right, do we have one more? Yes, we do. I know that I can't have an office in an individual's home, but what if I need to catch up on other business while in the home? So 460 IAC 6-10-11 prohibits an office in the residence of an individual. This includes that the provider of services shall not maintain an office in an individual's residence from which the individual is excluded from entering or from using any and all equipment contained in the office, or conduct the provider's business operations not related to services to the individual in the individual's residence. So there is the citation answering that. I think what I would also say is, if it's my home, I don't think I would want a one of my medical providers or my home health agency to be doing business out of my private residence. So you have the citation here, but would just also encourage, just if you just kind of think through it, it makes sense that we wouldn't want an office in an individual's home or to be doing other business in an individual's home. All right, next slide. I think we're going to time this perfectly. Future provider webinar topic ideas. So we talk about this every time. We want these webinars to be valuable to you. We want to provide you with the information you need and want. And we want to support you in your work. So if you have other suggestions or any suggestions about topics for us to cover, please email us those ideas at beadsproviderservices@fssa.in.gov. We want to hear from you for any future topics. You can also submit questions that you may have from today's webinar to the Beads Provider Services or Beads Help email address, whatever works. If you send us your questions, we'll receive them and we'll work to include them in a future webinar. We appreciate your time and attention today. Our next Case Manager monthly webinar and provider webinar is scheduled, our routine one, monthly one, is scheduled for November 25th at 3 Eastern time. Again, we appreciate your time today. We look forward to seeing you in November, and that webinar will be right before the Thanksgiving holiday. So I'll hold any good wishes for the holiday until then. But until we meet again, please enjoy some fall weather, and hopefully the rain will move out sooner rather than later. Have a great rest of your day and a great rest of your week. And thank you again for your time and attention.